I'm going to continue with talking about understanding glucose numbers. What makes glucose go down? If a person doesn't eat enough food, or if they are skipping meals, that can definitely make the glucose be too low. Extra activity or alcohol has the effect of making the glucose go down. If a person takes too much medicine or at the wrong time, that can make their glucose go down. A low blood glucose is a glucose level of less than 70. Your individual low blood glucose level may be different depending on the medications that you take. It is a good idea to talk to your provider about what your specific targets are. Symptoms of a low glucose. A person may feel shaky, nervous, or anxious. Sweating, may have chills or clamminess, may be irritable or impatient, may become confused, including having delirium. A person may feel like they are having a rapid heartbeat, like their heart is beating out of their chest. They may feel lightheaded or dizzy. They may be hungry or nauseous. They may feel sleepy. They may actually have differences in the way that they see as well, so they may have blurred or impaired vision. Tingling or numbness in their lips or tongue. They could have headaches, weakness or fatigue. They may feel angry, stubborn, or sad. They may have lack of coordination. If they are asleep, they may have nightmares or cry out while they're asleep. It also could lead to seizures or also being unconscious. Treatment for a low blood sugar is eat 15 to 20 grams of glucose or simple carbohydrates. You do want to recheck your blood sugar after about 10 or 15 minutes. If the low blood sugar is still present, you're going to repeat that cycle. Eat 15 to 20 grams more of glucose or simple carbohydrates. Wait another 10 or 15 minutes. Recheck your blood sugar. At that point, the blood sugar should have come up. If your meal is more than an hour away, you want to go ahead and eat the meal. So that will help prevent the blood sugar from dropping right back down. What is 15 to 20 grams of carbohydrate? So typically the glucose tablets, 4 tablets is 15 grams. The gel tube, typically it's going to be the whole gel tube that you're going to eat. 2 tablespoons of raisins, 4 ounces of juice or regular soda. You don't want to use diet soda. We want the sugar to raise the blood sugar. So 1 tablespoon of sugar or honey or corn syrup is 15 grams. If you choose to use milk, use the non-fat or the 1% milk and drink 8 ounces of that. Different hard candies or jelly beans or gumdrops or even things like Smarties are good sources of fast-acting carbohydrates. You want to look at the package to see how much is a 15 to 20 gram treatment for a low blood sugar. I'm going to talk briefly about the Glucagon Pen. Glucagon is a hormone that stimulates your liver to release stored glucose. The Glucagon Pen is used if a person with diabetes has become unconscious from an extreme low glucose level. If you have questions about the Glucagon Pen, you want to talk to your provider about that, you do need a prescription For a Glucagon pen, the pen will last 1 year and then would need to be replaced. Just some brief action steps that you may want to think about is carry a treatment for lows with you. Have your glucose meter with you so that you can check your number. If you have 2 lows that happen in a week, you want to contact your provider. So asking your doctor, your provider about a medication change. You want to have your information ready, like your blood sugar numbers, when lows happened, what did you do to treat the lows, how much food and activity did you have on that day.